members of the United Home Care Workers of Pennsylvania. Seniors, I am so happy to see so many home care attendants, seniors, and people with disabilities here today, united with one voice to tell Governor Corbett and state legislatures that we cannot afford any cuts to the home care in this year's budget. We know that there will be a large budget shortfall, but we cannot balance the budget on the backs of home care consumers and the attendants who we care for. We have a number of speakers who will begin talking about the importance of home health care. And we are going to start with Dina Nelson and Scott Rosenwald.
Hello, and thank you all for coming. My name is Dina Nelson, and I'm from the Allentown area. I work currently as a home health care attendant. I've been doing this for about the past 18 years. I do this work because I love it, and because it is so critically important to the people that we care for. Right now, if there are budget cuts in home care, it means that people like Scott will not be receiving the care they need. This means he might not be able to get out of bed, to get a bath, to feed himself. That's unacceptable by any standard. Also, if there are budget cuts in this program, it means that this program will not be funded in a way that can provide living wages and health benefits to myself and to other attendants. If I am sick and I go and I try to take care of my consumer, not only do I risk my health, but I risk his. Again, that's unacceptable. Without fair wages, turnover in this field is entirely too high. I can't tell you how long this man looked to find somebody who was willing to take care of him at the current wage. It should not be this hard for somebody to find care. Health insurance and sick days are important too. If I am sick, there is no backup for Scott. There is nobody else. So I end up working sick. This is why I am here. Somebody needs to represent the thousands of consumers and attendants in this program. And it's time that our government helps us. We are the taxpayers. And in the end, it costs the government approximately 1/3 to take care of him at home versus what it would cost them to take care of him in a nursing home. It only makes logical sense to take care of people like this at home. Thank you.
Good afternoon, ladies and gentlemen. My name is Scott Rosenzweig from the Allentown, Pennsylvania area. I'd like to start off by thanking our legislature for hosting us here today. I'd like to take a minute to address for you why the issues are so important for me. I rely on my attendant, Dina, for all of my basic needs: cooking, cleaning, laundry, shopping, even medication dispensing. Not a glamorous job. And at this point, it comes with no benefits and pays horribly. I spend about 30 hours a week in close proximity to my attendant. If she gets sick, I have no one to provide care for me. If she works anyway, I'm at risk of contracting any virus or bacteria that she might have because I'm immunocompromised from diabetes. It's critical that home care attendants have affordable health care. They need to be able to take sick days. They need to have substitute care attendants available, should this happen. Consumer-directed home care means independence, plain and simple. A better quality of life for those of us that require care. And less cost to the taxpayer than long-term in-house care. If the home care budget is cut on placed in long-term care, the impact of the state budget would be substantially higher. Multiply that by the number of Pennsylvania residents just like me, well, you do the math. Home care is the right choice for me and the right choice for the Pennsylvania taxpayer. Initially, I had trouble finding an attendant who was willing to work long-term for low wages and no benefits. Thank God, Dina, having been a friend for many years, took up the mantle. We need to have a home care system that works, and we need to be able to pay these attendants a wage that they can live on and provide the benefits to keep them healthy. Thank you.
Thanks, Dina and Scott. Now, I would like to introduce to some, and some of you already know him, Representative Girdley.
Good afternoon, everyone. Happy New Year. And hopefully, regrettably, I believe many of us in our party will be spending a lot of time at this microphone fighting for the causes we believe in. And I certainly, adamantly believe in this cause. But on a side note, Stephen, nice, terrible towel. Go Steelers. This is an issue near and dear to my heart. The fiscal impacts that we have in this state can't be rode on the backs of home care workers. You actually save us millions and millions of dollars by the services you give for the seniors and disabled. You already mentioned paid sick days and the need to have them in one of my bills that we will be running and aggressively talking about again this year. And I encourage you and meaningfully make this message important to everybody in this legislature that your cuts by the dollars are exponentially going to hurt people across the board. For every dollar we cut, we may not save $20 to $30, millions of dollars at the end of the day. So you need to rally, we need to support you, and I'm here and ready for the fight. I'm going to be back on the vice chairmanship of the Labor Committee, and we're going to ready to roll up our sleeves with you guys and be there for you. Thank you for giving me the opportunity.
Representative Girdley, from home health care all across the states, we like to represent you with this. We will be mailing it. You will see it on email, fax, in the mail. Let legislatures know home health care is here and we're here to stay. Now, I would like to represent to some of you, Representative Kula. Thank